Lung cancer is one of the leading causes of death in the United States, accounting for more than 150,000 mortalities each year. There are several different types of lung cancer, and the way we treat this disease depends on the type of lung cancer and how far it has spread. Today we're going to explain the symptoms of lung cancer, the stages of lung cancer, and we'll talk about what is meant when your doctor says you have a 30% survival rate or a 5-year survival rate of 20%. We'll also share some resources that can help you find clinical trials for advanced stage lung cancer. So let's first start with the basics. What are the symptoms of lung cancer? Some people who have lung cancer do not experience any symptoms at all. However, common symptoms of lung cancer include a persistent cough, wheezing, or shortness of breath. Other symptoms include chest pain, especially when breathing in or coughing, as well as an ongoing infection that just won't seem to go away. Unexplained weight loss and loss of appetite are also common. If you're experiencing any of these symptoms, please see your primary care doctor. Next, let's talk about the stages of lung cancer. There are 4 stages of lung cancer. Stage 1 means that the cancer is in its earliest stage and is localized to one area of the lungs. It has not spread to the lymph nodes or other organs. Stage 2 means that the tumor is larger and may have started to spread to nearby lymph nodes. In Stage 3, the cancer has spread further to lymph nodes outside of the lungs. And in Stage 4, the cancer has spread to distant organs, such as the brain, bones, or liver. When your doctor gives you a diagnosis of lung cancer and tells you that you have a 30% survival rate, they're referring to the overall survival rate for patients with that specific stage and type of lung cancer. They are not giving you a personal prognosis. Doctors use the term relative survival rate when talking about your particular situation. Your relative survival rate is based on the stage of your cancer, whether the cancer is considered small cell or non-small cell lung cancer, and your overall health at the time of diagnosis. For example, if you were diagnosed with stage 4 non-small cell lung cancer, your 5-year survival rate might be 20%. This means that half of all people diagnosed with stage 4 non-small cell lung cancer will live for 5 years after diagnosis. But this is just an average. It doesn't mean that you have a 20% chance of living for 5 more years. Your individual situation will depend on many factors, including the specific stage of your cancer, your performance status, meaning how well you were able to function before your diagnosis, your age, and your overall health. There are several different ways to treat lung cancer, including surgery, chemotherapy, radiation therapy, and targeted therapy. Treatment options depend on the stage of the cancer as well as the patient's overall health. Early-stage lung cancer that is not spread outside of the lungs may be treated with surgery. More advanced stage lung cancers may be treated with a combination of chemotherapy and radiation therapy. Newer targeted therapies are also available for certain types of lung cancer. These newer targeted therapies have fewer side effects and are more effective than traditional chemotherapy. If you have been diagnosed with an advanced stage lung cancer and are looking for more treatment options, we encourage you to contact a clinical trial center. Clinical trials offer patients access to cutting-edge therapies that may help them live longer or improve their quality of life. To find a clinical trial for advanced stage lung cancer, visit our website. You can search clinical trials by cancer type, location, and other criteria. We hope that this video was helpful. If you have any questions, please leave them in the comments below. We'll be happy to answer any questions you have. Thank you for watching.